50% of men in the world experience hair loss by the age of 50. Think about how many people you know that are bald or balding. You could be on the way to being one of these men, and you have no idea how to prevent or even restore your hair. In this video, I'm going to talk to you about how you can prevent hair loss. And if you stick to the end, I'll show you a way to get from this to this. The first treatment I'm going to talk about is Minoxidil. The other name for this is the trade name Rogaine. They both have the same active ingredient, so they work the same as far as we know. This is the oldest and first approved medication for hair loss that came out 30 or 40 years ago. Approximately 60% of men notice an improvement in their hair, and there's also about a 100% chance it will slow your hair loss. Some of the possible side effects are itching, burning of your scalp, lowering of your blood pressure causing lightheadedness or dizziness, but in general, it's very safe and very effective. You can buy this without a prescription at any drugstore or usually any grocery store in the section where they have shampoos. There are online services such as Hims or Keeps, Roman, that sell these products as well. The second medication I'll talk about is Finasteride, or the brand name Propecia. This came out over 25 years ago. The medication was actually formulated to help men with prostatic enlargement or prostate hypertrophy. But the same hormone that causes your hair to fall out can also cause your prostate to get enlarged. Finasteride probably has about a 65% chance that your hair will improve, but it will definitely help slow your hair loss as well. One of the things that concerns patients about this medication is a small percentage chance that you may have some sexual side effects, such as lower libido or occasional erectile dysfunction. This medication is available by prescription, but there are some services online that can provide it as well, such as Hims, Keeps, or Roman. So in a recent short video, somebody asked if Finasteride can actually impair the growth of beard hair or body hair. And that's actually true. Now, it doesn't happen all that often, and I've only had it brought up by patients several times in the last 26 years of prescribing Finasteride, but the DHT affects the scalp hair and the beard hair differentially. So in other words, high DHT levels can potentially make your beard thicker, grow faster, same with any other hair on your body. And it impacts the scalp in such a way that makes your hair fall out. So yes, theoretically it can cause a problem, but practically it's not usually that big of a deal. Next, let's talk about dermarolling or microneedling. This therapy has been out for a while, and initially was used for scalp hair improvement. Recently, there's been some companies that use it for enhancing beard growth or mustache growth. The theory behind this therapy is that the small trauma that these needles cause stimulates collagen production, blood flow to the areas that it's used on. In some European countries, they will actually add Minoxidil to the surface of the skin, then dermaroll it, or do it the other way around, where you dermaroll and then add Minoxidil. That's called mesotherapy. The evidence about whether this works on the scalp or the beard is very scant. Actually, there's not much out there to say that it really improves. And a lot of the improvement may actually be due to the concurrent use of Minoxidil and not necessarily the microneedling. The evidence is not great, but we're still waiting to hear about more studies to let you know how well it works. The next treatment I'll talk about is PRP. That stands for platelet-rich plasma. The platelets in your body that help blood clot. So if you cut yourself, the first action your body has is the platelets will do something that's called degranulation, and they form the initial clot. It just so happens that these platelets have within it little packets of growth factors, and it's been shown these growth factors can actually help your hair grow. We don't know the exact mechanism, but somehow it has the same effect as some of the other medical therapies we've been talking about. Now the process is you actually have to come into a doctor's office, have some blood drawn, we spin it down in a centrifuge to separate the plasma from the rest of the blood. This plasma is then injected back into your scalp. After we inject this into your scalp, then we have to do something that's called activation, and that is a process that will help the platelets release the growth factors. One of the ways to activate the platelets to release the growth factors is with microneedling, and in fact that's what I do in my office. The growth factors are that it will enhance the hair, the quality of the hair, and also slow hair loss. Different PRP devices that produce the PRP require different protocols. So in some offices, you might have to visit monthly for 3 or 4 months in a row. Other offices, they generate more platelets at a higher concentration. You might only have to visit those offices every 6 to 9 months. Anyway, the doctor or clinic that you go to will help guide you through that. The next treatment I'll talk about is something called Photobiomodulation. In other words, laser treatments for hair loss. And basically these involve low-level laser light therapy where you wear these helmets or hats that actually have lasers embedded up in the hat themselves. These lasers have a very specific wavelength, and they're called cold lasers. They're not going to damage your skin. There's been no evidence that it causes any problems with your skin. But the theory is these lasers shine their light on the follicles, the laser penetrates the skin and stimulates the mitochondria, the powerhouses in your cells that stimulate the follicles to grow better. Some of the evidence shows that maybe 55–60% of patients notice an improvement in their hair. And again, we believe it slows your hair loss. So this is one of the treatments that you can consider for treating your hair loss. So we've talked about different medical therapies for hair loss, and they're all important. The more of these treatments that you use or utilize, the better off you'll be, specifically for slowing your hair loss. If you've already lost the follicles, there's nothing for these medications to work on. The only assured way of getting hair into totally bald areas is with hair restoration. I've been doing hair restoration for 26 years, and this is really the only foolproof way to get hair into the bald areas of your head. If you're interested in more information about hair restoration, please check the description below. You may not know, a lot of celebrities have had hair restoration procedures. If you're interested, click on this video to learn more about Brian Urlacher and Deion Sanders' journey for their hair loss.